So when a patient is diagnosed with prostate cancer, the urologist or urologic oncologist or medical oncologist has a number of different tools available to them to help make that decision process. One of the challenges that we have with prostate cancer is that we can look at this disease process, and again, not every cancer is the same. We know that there is a specific subset of the patients who are diagnosed with prostate cancer today that actually have lower grade, lower volume prostate cancer, but that's not everyone. And if you actually lump everybody into that category, we're going to find that those cancers will continue to grow, and there is an opportunity that we had to treat those patients and actually cure them. Okay, on the flip side, we also have patients who actually have these low-grade cancers, and again, we can follow them quite closely. So amongst the many tools that we have, utilizing the pathology, looking at the PSA, looking at potential biopsies, we're now using MRIs, we're now using specific techniques for doing ultrasound and ultrasound guidance, and looking at all these different things to find the cancer. Once we find the cancer, the question is what kind of cancer is this? Is this indeed a low-grade cancer, or is this indeed a low intermediate grade prostate cancer that Oncotype DX has described? And the answer is maybe, but if you go down to the heart of where those cells are and look at the genes, do the genes actually concur with that diagnosis? If they do, this patient is very well a good candidate for active surveillance. If not, you need to have a long, hard look at whether this is a time to consider an immediate intervention for those kinds of cancers.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.